All right, we're going to get started. Good afternoon, everyone. My name is Jonathan Novick, and I am the Outreach Manager for the New York City Mayor's Office for People with Disabilities. Thank you so much for joining our COVID-19 vaccine town hall today. Before we get started, I just want to do a brief access check. So first, for those of you joining us via Zoom, we have closed captioning available today. If you require and would like to access closed captioning, please go to the bottom of your screen and select CC for closed captions. With this, you can turn on, enlarge, or view a full transcript of the captions, courtesy of Total Caption. If you prefer to look at the captions in a different way, if you prefer to look at a stream text link, we also have that set up, and it is in the link in the chat that I just shared. In addition to captions, we have American Sign Language interpretation. Today, courtesy of LC Interpreting Services. Today, we're in a Zoom webinar, which means that we are somewhat in control of the visuals. The reason we've selected this format, we have a few hundred people joining us today, and to ensure everyone gets the message and our accommodations are set up properly, this is the most successful format for that. With that being said, ASL interpretation will be visible at all times. We will be ensuring that visually we're turning off our cameras when we're not speaking, so the ASL interpretation will be maximized while it is taking place, while someone is speaking. For participants who are blind or low vision, as well as our friends joining us via phone, we will make sure to describe all of our visuals, including the slide deck presentation that Dr. Ige will be sharing momentarily. For questions and comments, and there will be a section for questions, comments, and discussion, there's specific instructions that I'm going to provide to everybody. But for now, I just want to say, in terms of written communication, please only use the chat if you're having an issue with communication or anything along those lines, or to share resources. For all questions that come up, please use the Q&A feature. The Q&A feature allows us to easily see and answer and organize the questions and make sure everyone get an answer. For folks joining via Zoom, if you have questions or comments, you can raise your hand. You can do so by selecting the raise hand button, or if you're joining us via phone, you can press *9 to raise your hand. Once again, we'll open up to discussion later. We'll repeat these instructions, but for now, this is how we are going to be having and holding our discussions. This webinar is being recorded. In addition, the transcript will be saved for later terms, and the presentation that is going to be shared, all of these things will be sent to everyone who has registered for this webinar, and feel free to share that with other members of the community. With all of that being said, it is my pleasure to introduce the Commissioner for the Mayor's Office for People with Disabilities, Victor Calise.
Thank you, Jonathan. Thank you for everything that you continue to do for the community. I know you have a very hard job at times, but I want to say thank you, John, for everything that you've done to put this together, and the rest of the MOPD staff. But more importantly, thank you to all of you for attending this virtual town hall on COVID-19 vaccines. Today, we will be sharing the latest information on vaccine distribution in New York City. And after the presentation, we will open it up for you to hear questions from you and get your feedback in the discussion point. Since the beginning of this pandemic, my office and Jonathan have been heavily engaged with the community, holding many conversations like this one, sharing COVID-19 resources from city agencies, soliciting feedback from you, the disability community. If you are not already participating in these monthly calls, we invite you to register now at the link being shared in the chat right now. If you are joining us via phone and you would like to join the call, you can connect with Jonathan to be added to the list directly. His number is 212-788-2856, which is the same number you have seen to request accommodations on the flyer. Since March 2020, our city, our way of life, have certainly been rocked by COVID-19 pandemic. We've been social distancing, we have been convening virtually, we have been getting tested, and we've been doing everything we can do to stop the spread and protect our family, friends, and neighbors from COVID-19. Now, there is some great light at the end of the tunnel with the COVID-19 vaccines. And since the approval of these vaccines, my office has been working closely with the Department of Health and Mental Hygiene to ensure the vaccine distribution is accessible and inclusive for people with disabilities. The city operated hubs are using accessible medical facilities and accessible school buildings. For additional community pop-up sites that are not controlled by the city, we have provided guidance materials on ensuring physical accessibility. And we will continue to have conversations regarding alternatives if necessary. We are providing guidance on disability awareness for Vaccine Hub staff members so they understand how to work with the disability community. We have been working closely with the city's IT department to ensure the digital accessibility of COVID-19 related information being shared is accessible on the city websites. And just this morning, we presented to the Vaccine Equity Task Force on accessible virtual outreach for people with disabilities. And during this presentation, we covered the proper steps to hold virtual meetings in a way that is accessible for everyone. We will continue to be able to do that because even this morning, there were an abundance of people that wanted to join, and we know we need to do more. All the while, we have been sharing information through our listservs, our social media channels, and through meetings like this one. So today, we are holding this virtual COVID-19 vaccine town hall for two reasons. First, we want to provide you with the latest information surrounding COVID-19 vaccines in New York City because we know that it's very confusing. And secondly, and more importantly, we want to hear from you, the community, about your experiences. We want to know your questions, your concerns, and things that we as a city might be overlooking when it comes to access and inclusion for people with disabilities. We'd like to think we get it right all the time, but it's always better to talk with the community. And it's been great so far, and we've been taking a lot of your feedback and make changes along the way. And it's important to note that there are many moving parts to this vaccine distribution in our city that extend way beyond what we can do. For example, we are following both federal and state government regulation when it comes to eligibility. If you would like to advocate that eligibility criteria be expanded, we recommend that you contact the New York State Governor's Office. Their phone number is 518-474-8390. Jonathan will drop information on how to contact them electronically. And you can also mail them at the Honorable Andrew M. Cuomo, Governor of New York State Capitol Building, Albany, New York, 12224. And if you want to reach out to the federal government and the Center for Disease Control, please call 1-800-232-4636. Jonathan will put the CDC contact form on in the chat right now. And with today's presentation, we hope we can answer as many of your questions as possible and address the concerns that you may have. But we encourage you to stay in contact with us, contact our office with issues, and stay connected with us at 212-788-2830 and call our office ASL Direct video phone at 646-396-5830. Visit our website or our social media at NYC Disabilities. It's a lot to be said, but who we really want to hear from is the Assistant Commissioner of the Department of Health and Mental Hygiene, Dr. Ige. Dr. Ige, the floor is yours, and we look forward to hearing what you have to say. Thank you for your time and commitment to people with disabilities.
Thank you, Commissioner. I am very excited to be here. and to have the opportunity to be part of the conversation. I know that there are a lot of questions about the vaccine itself and about the process. And so I will start with a brief overview of some of the frequently asked questions about the vaccine. I will start by introducing myself again. I am Simbo Ige. I'm a public health physician, and I now serve as the Assistant Commissioner for the Bureau of Health Equity Capacity Building for the New York City Department of Health and Mental Hygiene. And I will be sharing with you some of the information about the vaccine. Next slide. There are some key messages we're going to start with. We have some frequently asked questions that I will provide some answers to. We'll talk about appointment scheduling, some potential side effects of the vaccine, and what you can expect after vaccination and where you can get more information. Next slide. So there are a lot of concerns about the vaccine. So I want to start by saying the COVID-19 vaccines are safe, they are effective, they are free for everyone. It is at no cost to you as an individual. The vaccines are available to people of all immigration statuses. You do not require to disclose your immigration status before vaccination. Vaccination is not a public benefit under the public charge rule. And when people receive the vaccine, their privacy will be protected. Next slide. So a lot of people want to know, do the vaccines work? These vaccines are supposed to protect you from COVID-19. Do they work? And the short answer is yes. We have 2 vaccines right now that have been approved for emergency use by the Food and Drug Administration. Both of these vaccines have gone through different phases of trial to determine if they truly protect against COVID-19. And both of them have been found to offer at least 94% protection from COVID-19. So in clinical studies, both vaccines were more than 94% effective at protecting participants from COVID-19. And this is why we're confident that they work, the vaccines work, and they are effective. Next slide. Another question that people ask is, are these vaccines safe? Will they make me sick? The vaccines are safe. You cannot get COVID-19 from the vaccine. And the simple reason for that is because the vaccine does not contain the virus. The vaccine only teaches your body's immune system. That's how your body fights against diseases. It teaches your body how to fight the virus, so that when or if you become exposed to the virus in the future, you know how to fight it. Your body can fight it off. So again, the COVID-19 does not contain the virus. It only helps your body fight it off. So, and another thing that people want to know is, why was the vaccine developed so quickly? And the reason is that researchers have been working on this vaccine for coronaviruses for many years. They did not start from scratch. The mRNA, that's the messenger RNA, is a new vaccine technology, but it has been studied for over 30 years. So we were able to get this vaccine as quickly as we did because we had the funding, the scientists, everybody was working on getting this done because this was a global pandemic and all hands were on deck. there were no corners cut. There were no compromises in the process. The vaccines still had to go through all of the stages of trial before they were authorized for use. Next slide. So some New Yorkers are worried about getting the vaccine if they already had COVID-19. So the recommendation right now is that you still need to get vaccinated, even if you have previously had COVID-19, because the vaccine helps prevent you from getting reinfection, getting the infection again. So if you have tested positive for COVID within 90 days, you may choose to wait to get vaccinated, because it is very unlikely that you will get COVID again during this time period. But if you're worried, then you can talk more to your provider who knows your own personal history about what the best decision for you is. But if you currently have COVID-19, please wait until your isolation has ended before trying to get the vaccine. We don't want you to inadvertently infect others in that process. We also want you to know that you do not need to get a COVID-19 test in order to get vaccinated. A test is not required. The only thing that we want to know is that you're not currently sick and you're not, you don't have the potential to infect others. So if you're sick or you test positive for COVID before your appointment, please stay home so that you don't expose others to the virus. Next slide. Should I get a vaccine if I have an underlying medical condition? Now, COVID vaccination is very important for people who have certain underlying health problems like heart disease, chronic lung disease, diabetes, and obesity. These conditions make it more likely to have severe illness with COVID should you get sick. So these categories of people, we want to encourage them to get the vaccine because protection from COVID will be very important for them. But if you have questions or you're worried about other underlying conditions that you may have and how that interacts with the vaccine, please speak to your provider who knows your history and can give you more personalized advice. If you have allergies, that shouldn't stop you from getting vaccinated. But if you have had severe allergic reaction to other vaccines or other injectable medicine, or you think you may be allergic to any ingredient in the COVID-19 vaccine, please talk to your provider first before getting vaccinated. At this time, the vaccine does not contain eggs, it doesn't contain latex, so we don't expect that having allergies to those things should stop you from getting the vaccine. Next slide. So I am going to move on to the process. So if you have decided that you would like to get vaccinated, then the question becomes, am I eligible? Is it my turn to get vaccinated now? As at Monday, January 11, the following groups of people were eligible. I want to say that eligibility, like Commissioner said at the beginning, is determined by New York State. So the governor makes the announcement about what category of people are currently eligible. And right now, we have healthcare workers who are at risk because of their job, they're exposed to the virus. We have people who are 65 years and older who tend to have more severe illness if they have COVID-19. We have residents and staff of nursing homes and certain other group living facilities who are also eligible. And we also have frontline essential workers teachers, school staff, daycare workers, transit workers who are eligible. There is a full list of all the different categories or of New Yorkers who are eligible for the vaccine either on our website at nyc.gov/COVID vaccine distribution. I'll say that again, that's nyc.gov/COVID vaccine distribution. Next slide. Now, to make this easier to follow, we have listed 5 steps you need to take before you schedule your appointment or before you get to your vaccination site. One, like I said before, you need to make sure you're eligible. And for the complete list, there is a website where you can check, which is nyc.gov/COVID vaccine distribution. You can schedule your appointment in 2 ways. You can schedule it online or you can schedule it by phone. The phone number for scheduling is 877-829-4692. We find that for older adults, that may be easier than trying to schedule online. And some folks who do not have email addresses find it easier to use the phone number. People do complain that the wait time is long on the phone. So I want you to know that ahead of time so you don't get discouraged because there's a long wait time. But we find that for older adults, the phone might be easier for them than trying to schedule online. There is a form, it's a self-attestation form that is required to be filled before your appointment. And that form is available at vaccineform.health.ny.gov. And this form is just to attest that you're eligible. It asks for your name, it asks for your age, it asks for your appointment time, and then it asks for your email, which some older adults or those who don't have emails can find challenging. If you're not able to fill this form online and you book an appointment at a city-run site, you will have the opportunity to fill that form in paper at the site. So if you're not able to do that online, don't worry. You can do it on site. So try and get to your appointment a little earlier so that you can fill out the form. On the day of your appointment, remember to bring along a proof of eligibility. At this time, the vaccine doses are limited, so not everyone can go just yet. So if you're eligible, then you need something to prove that you're eligible. So if you're eligible by age, then you need some documentation to show your age. And that can be a passport, it can be an ID, it can be the New York City ID, it can be a birth certificate, something that has your age on it to show that you are eligible based on your age. If you're eligible based on your job, then you need something to show that you work in that job. And that can be a pay stub, it can be a letter from your employer, it can be a list of employees at that organization, it can be an ID with your job on it, something to show that you work in that job. From last weekend, there's also a requirement for New York State residency. So if you have a New York ID that shows your age and your address, that's also fine. Something to show that you live or you work in New York City is now an additional requirement. Please remember to wear a face covering when you're going for your appointment. Some people have been turned away because they don't have a mask on. So we don't want you to be taken by surprise. So we'll remind you to please wear your mask before you go. And to remember to make an appointment for your second dose and make sure you get the second dose. At this time, new appointments for first doses are not available. And that is because we have limited supply of doses from the federal government. We're hopeful that appointments will come back online soon. So you may have heard that some people's appointment were canceled for next week. And if you had scheduled an appointment for next week at a city-run site, you will be automatically rescheduled for the following week. What that means is if you were scheduled for, let's say, the 24th at 10 a.m., you will be automatically rescheduled for the 29th at 10 a.m. Someone will give you a call to confirm that appointment. And if you're not able to secure appointment online or by phone, please don't get worried. We just need to be a little patient for when more doses become available. Our hope is that all New Yorkers will be able to get the vaccine soon. But the vaccine will not become available for everyone until maybe mid-2021. So we just want to encourage you all to be a little patient while we get more doses, because I know people are quite frustrated about not being able to get an appointment even though they're eligible. But be patient, more doses will come, and as more doses come and more appointments become available, you will be able to schedule. On the vaccine pod website, that's the city-run vaccination site, you're able to subscribe for updates for when appointments become available. And I can share that with Jonathan so that if that can be shared with everyone. So you can get notified when appointments become available at the vaccination hubs or mass vaccination sites. Next slide. So this is what the website looks like for finding locations offering vaccination. And when you go to that vaccinefinder.nyc.gov and you type in your address, it will show you all the locations around you that offer vaccination. It does not mean that there are appointments available. It only shows you that these are the sites that offer vaccination. Currently, a lot of sites do not have appointments available because there are limited number of doses. Please note that each provider manages their own schedules and appointments. That is another frustration that people have expressed, that I have to fill different forms for different sites. The reason for that is that there are some sites that are run by Department of Health, there's some sites that are run by health and hospitals, and there's some sites that are run by the state, and there's some sites that are run by private providers. It's complicated, so we want you to be aware of that so that you're not surprised by that. But we're working on a system to make it easier. If you go to a city-run site, if you type in your address and you see the list, you will be able to see NYC health and hospital site, or you will be able to see NYC clinic or hospital. If you go to those sites that say NYC hospital or site, you will be able to fill just one appointment and be notified when appointments become available. And on the NYC sites, it will tell you if there's an appointment available or not. Next slide. So what if you need help getting to your appointment? So there are folk who need transportation support to be able to get to the appointment. So if you're 65 years or older, or you're not able to use private or public transportation to get to your appointment, the city is offering transportation free to and from city-run vaccine sites. And there are a number of options available for that, including Access a Ride or Medicaid support transportation. If you book your appointment through a city-run site, you will be provided information on how to arrange transportation for your appointment. And for customers who are deaf or hard of hearing, they can use their preferred relay service, or they can call 711 to be able to get support for transportation to their appointment. There's also information available for paratransit services at MTA website. Next slide. Now, some people are also worried about the side effects. What can we expect after taking the vaccine? So there are some side effects that may happen, and these side effects are usually mild to moderate. This may include swelling at the site of the injection. Some people have headaches, body aches, tiredness, a little of low-grade fever. If that happens, we don't want you to get worried. It usually will start within the first 3 days of getting the shot. And usually the next day after the shot is when the symptoms tend to start. And they last for about 1 to 2 days after they begin. The symptoms are commoner after the second dose, and they're less common in older adults. Older people tend not to have, so many symptoms. Next slide. If you do get the symptoms, you can call your provider if you have any side effects that concern you, or if the side effects don't go away after a few days, or if you notice that the redness or soreness where you got the shot is increasing after 24 hours. You can also talk to your healthcare provider about taking over-the-counter medicine like Tylenol or Advil to relieve the pain or discomfort. Next slide. We want to encourage you to get the second shot, even if you have this mild to moderate effect. This is not you getting COVID. Sometimes people feel like, oh, now I've got COVID. No, this is just your body building up immunity. And that's why you have these mild symptoms. Please go ahead and get your second shot, even if you have this mild to moderate side effects. And if you need more information, don't hesitate to call your healthcare provider. You should only, stay away from a second shot if your healthcare provider tells you not to. You can also call 311 or text 311-692 if you do not have a healthcare provider. So if you want to be linked to services, whether or not you have insurance, you can call this number and you will be directed appropriately. Next slide. We want to remind you that even though the COVID vaccine is 94% effective, it is not 100% effective. And the full protection only kicks in after about 2 weeks after the second shot. So we want to encourage you to continue to practice the preventive measures that we know work, even after you've received your vaccination. Please stay home if you're sick. Please stay 6 feet away from others when you're outside. Please wear a face covering when you're outside of your home. Wash your hands as often as you can. And stay informed and listen for information from public health officials. Choose information from trusted sources. There's a lot of misinformation out there. So use trusted sources for your information to get updates on what is happening. And please don't lower your guard just yet. The vaccine is here. We're very excited. It's a game changer, but it's going to take a while yet for everyone to get the vaccination. So please continue to practice the preventive measures that we know work. Next slide. So here I have listed some sources of information that will be useful to you. We have a flyer on what older New Yorkers need to know about the COVID-19 vaccine, and that tells you the steps that I've shared with you today, how to know if you're eligible, how to book an appointment, etc. We also have a flyer on getting your COVID-19 that also details the steps that you need to take before your appointment and the forms that you need to fill. We have a pump card that's on preventing COVID-19 that is a quick reminder of the things you need to do to stay safe, and that's available in different languages. The vaccine appointment phone number is here on the slide. It's 877 VAX for NYC, and that is 877-829-4692. You can also request a speaker if you want additional information and you want someone from the Department of Health to come speak to you, speak to your group, speak to your community. You can send an email to icspeakersbureau@health.nyc.gov. And we have a link here for you where you can ask questions or you can share concerns or you want to make a recommendation to the Department of Health for anything related to COVID-19. And that link takes you to the form where you can put in your questions or your concerns as well. Next slide. And that is the end. So thank you very much for your patience. And I think now we will start taking questions.
Yes, that is correct. Dr. Ige, thank you so much for that incredibly informative presentation. As a reminder, everyone who is on this call, even if you registered and you have to jump off, you will all receive a copy of the transcript, the PowerPoint presentation, as well as a recording of this call and all of the questions asked with answers. So all of you will be receiving that. So with that information, take as much or as little notes as you like. Okay, so we've got a fair amount of questions and we're gonna get through as many of them as we can. And I am just going to go over the instructions once more. So if you have a question, I encourage you to either please insert it into the Q&A box, not into the chat. The chat, it's gonna get lost just because we're getting a lot of messages and we're sharing our resources of our own. It's just much easier if it's sent through the Q&A. If you prefer to ask your question out loud, please raise your hand. You can raise your hand by selecting the raise hand button as a participant, and we will see you. Once we call on you, we will provide you with the ability to unmute yourself. You can ask your question, we'll give you an answer, and then we will go from there, and then we will put you back as an attendee and so on and so forth. If you're a person who communicates in ASL and you don't feel comfortable speaking or entering a long question into the chat, please just type ASL question into the Q&A. With your name, we'll be able to recognize you and provide you with video access so you can ask your question. So once again, if you are only comfortable signing, type ASL question and I will promote you so you can turn on your camera and you can ask your question and then we will go from there. There are a lot of questions. We're going to get to as many as we can. So I ask that everyone please remain patient and know that you have our contact information and we will be following up as much as possible with notes and with answers. With all of that being said, let's start with some of these questions. So the first one we have from the Q&A is, how many times does a person get a vaccine or flu shot?
I will take this separately. The flu shot is a different type of vaccine, and the flu shot right now is required every year. And that is because there are some slight variations in the different kinds of viruses that require new shots every year. For the COVID vaccine, right now, we don't have information about how frequently you will need to be vaccinated. What we do know is that for those who have been in the trial, they had sustained protection from COVID for many months now, up to 3 months, 4 months, and they continue to be followed up. But we don't know yet how long that protection will last and if you're going to need additional vaccines in the future.
Thank you very much, Dr. Ige. The next question is from David Logan. Will MOPD help in getting us appointments? So I can say that we have been, as Commissioner Calise mentioned, we have been involved in many ways in terms of the vaccine setup. We've been working with the Vaccine Equity Task Force and providing input on accessibility, interactions, and the digital content and communications that are coming out of the Department of Health and Mental Hygiene, and we continue to have a strong relationship with them. But when it comes to actually getting appointments, the methods that Dr. Ige cited, the phone number, signing up online, et cetera, those are currently the ways. There are other, we're looking into the ability for our office to help individuals directly sign up, but this is something I don't have new information on just yet. But what I will say is we are working as hard as we can in our capacity as the city to make the process easier. But as Dr. Ige noted, as Commissioner Calise noted, we are at a time where there is a very high demand for the vaccine, but the production to meet the demand is not quite there. So it's important that we all, continue to follow the core 4 principles, that we continue to, wear a face mask if you're able to, social distance, stay home if you're sick, and all of these things that we have been doing. And as the process continues, we will try and make it easier and easier as possible for those appointments, taking into consideration individuals who don't have internet access, individuals who have difficulty filling out forms, and other things like that. So MOPD, we're working as hard as we can to simplify the appointment process, but there's still, unfortunately, the issue of the lack of doses, citywide, statewide, and nationwide, that we're working on addressing. Okay. The next question is from Carolyn Wember. The question is, why weren't younger people with disabilities who depend on personal care in the community given the same priority as workers who take care of them? And when will that population be eligible for vaccines?
Yes. In terms of those who are prioritized, and when the eligibility will change, that is being determined at the federal government level and at the state level. Advocacy is ongoing for other categories of people that should be prioritized, but at this time, those decisions are made at the federal and the state level.
Thank you very much. Next question. Can someone explain why is it important to know if someone had a flu shot? Will they be denied the COVID-19 vaccine if they have refused the flu shot or have not yet received due to no face covering no face-to-face provider available? No face-to-face with the provider.
Right. Previous history with the flu shot is not a requirement for the COVID vaccine. And if that question is being asked maybe from a private provider, I am not sure why, but receiving or not receiving the previous flu shot does not impact this vaccine. That information only becomes relevant if you've had an allergic reaction to a shot before. So they want to make sure that you're not going to have an allergic reaction to this. Otherwise, whether you have received a flu shot in the past or not, if you're eligible for the vaccine, you should be able to get it.
Thank you very much. Next question is from Betsy Mandel. I have made appointments for other people as the system can be challenging for some to use. When I had issues, I called the help desk numbers that were available. Although the people on the phone were very nice, none of them were able to help. As they said, they have very limited access to the system and there was no supervisor to connect me to.
Yes. I know that initially people thought that there was a glitch in the website or there's something wrong with the tech issues, but the real issue is that the doses were limited. And so appointments were not able to be booked if you don't have the doses available. So that is the reason for some of those challenges, and which is why we have encouraged people to be patient now until more doses become available. There will be a difficulty getting appointments just because the doses are not there now.
Yes. Okay, thank you very much. And there was a part two to that, which we've sort of addressed already, but I just want to make sure we get all the questions. When will people with disabilities be eligible, and people with Down syndrome, are they now considered a high risk group?
Not to the best of my knowledge, and in terms of when they will become eligible, we'll have to wait for the governor's announcement. We don't have a date yet.
Yes. And to circle back on something Commissioner Calise said, we do encourage advocacy. We do encourage you to reach out to the governor's office, reach out to the CDC. As everyone knows, we had a federal change in the administration. Perhaps that will signify a larger eligibility. But that contact information that we put in the chat, we encourage you to reach out and explain the intricacies of the disability community, because of course it's not just every person with a disability, but those with compromised immune systems, those with specific disabilities that impact respiratory system, immune system. We do encourage you to reach out and advocate for these communities to be included. But in the meantime, the decisions being made are on the state and the federal level, and we are trying to create the boots on the ground effect in an accessible way while still, following those regulations. The next question is, are New Yorkers on the autism spectrum as high a priority to receive the COVID vaccine as individuals with physical disabilities?
Not at this time. Underlying conditions have not yet been used as a criteria for prioritization at this time. But more information will be available about who's next in eligibility when the governor makes an announcement.
Okay. My wife and I just had a baby and she's nursing. Is she eligible for the vaccine?
Eligibility now is based on two things, age. If you're 65 years or older, you will be eligible, or based on your job. If you're in a job that is considered high risk or high risk of exposure, if you're a frontline health worker, if you are a medical examiner or a coroner who has to deal with COVID-19 cases, or if you are an essential worker and have to interface with a lot of public, then you're eligible. If you're not in these two categories, then it will you still have to wait a little longer.
And I think very similar answer to this next question. I have a 19-year-old son with autism who is considered obese. Does that mean that he qualifies right now for a vaccination?
At this time, underlying condition is not used for eligibility yet. And children, for the Pfizer vaccine, it's available for individuals 16 years and older. For the Moderna, it's available for individuals 18 years and older. But at this time, younger people are not yet eligible unless they fall into the worker categories that we have shared. If they don't work in those jobs, they will not be eligible just yet.
Thank you.
Clarifying question, aren't people who live in congregate settings eligible no matter what their age?
Yes.
Can you expand on that? So the congregate settings, those include nursing homes, residential facilities, including those run by OPWDT and the
Yes.
State Office for Mental Health, and others?
We also have those who are incarcerated also being eligible.
Thank you. Is there any talk about offering the vaccine to parent caretakers of children with disabilities, including adult children, those over 18? Not
at this time. I believe that eligibility will open up as time goes on, but right now the 1A and 1B is still limited.
Okay. So now I'm going to switch over. I'm going to take a break from the Q&A and call on some participants who have had their hands up for a while. First, we have a question from Margot Shaw. So Margot, I'm going to unmute you or allow you to talk. You just need now to unmute yourself and you can ask your question.
Okay. Hi. So I am the parent of a 24-year-old with autism, and he lives home, as has been encouraged by our government. There is difficulty even to try to get your child into a congregate setting. With that being said, all the reasons that people in a congregate setting would need the vaccine, our kids that live at home with us need as well, in order for them to negotiate what they have to negotiate. And they are high risk. There are several comorbidities that go along with autism, including, and I'll be brief, including sleep disorders, epilepsy, OCD, ADHD, feeding disorders, etc., and myriad medication. Is there any way for us to make the governor aware of how important it is for our kids, older adult kids, and to be vaccinated, even though they're not in congregate settings?
Right. I think that right now, based off of what Commissioner Calise said, advocacy to the governor is the best route right now to elevate these concerns about, you know, who should be eligible and why. So I think that there is an opportunity to continue to advocate through the governor's office.
Thank you.
It's important. This is Commissioner Calise. It's really important for you to advocate. We are doing our share in the city. We understand that other states have opened it up to people with disabilities. We're concerned just as much as you are that we are not represented. We've been working with the Department of Health and Mental Hygiene on this. It's the reason why we put this call together to say, we want to be as transparent as we possibly can and letting you know what we know and how to get it. People with disabilities in New York State are not on the list. We've been advocating the way that we have through the city to be able to do that. But at this time, it isn't changed. And there may be a couple of reasons for that. A, they need to be more aware at the state. And B, there aren't that many vaccines, and it's been very hard for them to open it up because the federal government hasn't delivered them because of shortages around the country. I would hope that once we get more vaccines, people with disabilities would be prioritized.
Right.
But if people don't know about it and people aren't hearing from constituents, it is very tough for you to for that to be heard or seen. So it's important that A, you advocate with the state, or B, advocate with your elected officials, assembly members, senators, council members. We elect them, and that's important for us to be able to push them. And you know, again, we're doing everything we can in our capacity to make it happen.
Thank you, Commissioner Calise and Dr. Ige. And Margot, thank you so much for your question. I'm going to just put you back as an attendee. Thank you for your question. Next, from the participants who have their hands up, we are going to hear from Gwen Sachs. Gwen, I'm going to allow you to talk. If you unmute yourself, you can go ahead and ask your question.
Good afternoon, everybody. And I just really want to thank you all for having this. It's very, very important, keeping us in the loop. And Doctor, I wanted to ask you a question. And thank you for all you've done during this whole period of time, if nobody has today. Are people getting their second doses before people are getting first doses?
Yes. So the protocol right now is if you get your first dose, we want to make sure that you get your second dose as well. So there are there is some preference for second dose appointments. So if you check on the website for the city-run site, it will tell you that there are no first dose appointments available just yet. So that's where we are at the moment. Trying to make sure that folks who got their first dose got their second dose. And as more doses come in, making sure opportunities are provided for those who need their first doses.
This is Commissioner Calise. I want to point out that there are two different types of websites, meaning one in the city and one with the state. So I don't want people to get confused. You can make an appointment either way when vaccines are available. So just realize that there's a city website, and then we're doing them and in city facilities.
Right.
And there is a state website that are being done in state facilities. So
Right.
please be aware of that. I just want to make sure that's clear, because there is a state distribution and a city distribution.
Yeah, and I can put in the chat the links to those different sites if it will be helpful.
Thank you, Dr. Ige.
Thank
you, Dr. Ige. Gwen, thank you very much for your question.
My pleasure.
I'm going to put you back as an attendee, and we are going to move on to Ann Hassett. Ann, you are able to unmute yourself and ask your question now.
Thank you very much for taking my question, and thank you for having this program today. I'm asking the question on behalf of my daughter, who lives 24/7 on a ventilator. She also is a teacher. Through serendipity, she got a first dose of the Pfizer vaccine when a pharmacy that she knew about had some extra doses at the end of the day. That pharmacy cannot guarantee her a second dose, and she cannot make an appointment through the city or the state, because if she's asked the question and answers it truthfully, that has she had the first dose, they say, we won't take you for a second dose appointment. What can be done for her? It shouldn't be that extra doses at the end of the day are wasted. And this pharmacy, rather than throw it out, gave it to some people, but they might as well have thrown it out if she can't get a second dose. So what can you do for her?
So if you're not able to get your second dose where you got your first dose, you should try the city run sites. If you're saying you're not able to get appointment for your second dose at the city run site, I will have to look into that and see what is.
I've tried, thank you for that answer. I've tried to make appointments through the city run sites and I cannot get one.
Have you tried the mass vaccination sites?
What do you mean by the mass vaccination sites?
There are 5 locations in one location in each borough that, the ones that have between 2,000 to 5,000 appointments a day.
Well, that's not, when you go to the website and look at those sites, it's not obvious which ones those are. How do I know that?
If you look at the list, it will tell you NYC mass vaccination sites. If you type in your address, I will have to look into that and see what is going on. I know that the biggest challenge we have right now is just that there are no doses available. But I will encourage you on the city-run site, the website that is vaccinepod.nyc, you're able to subscribe for when new doses become available to be notified.
Thank you for that answer. I will put my email address in the Q&A, so if you have more information, you'll be able to reach me. Thank you both very much.
I will take that as a personal assignment.
Thank you, Ann. Thank you, Dr. Ige. Commissioner, you have something else to say, Calise?
Oh, I'm just no. Dr. Ige has it under control.
And we appreciate that so very much, Dr. Ige. Thank you for all of your information that you've been sharing. Okay, Susan Chi, I'm going to allow you to talk. You should be able to unmute yourself and ask your question now.
Hi, Dr. Ige. My name is Susan Chi. I have a question. I have a cerebral palsy and like a pulmonary condition. Where should I get the vaccine? Like, should I get it in the hospital setting or should I get it in a vaccinated site to be safe in case I have an allergic reaction or any things that popped up that is unexpected.
Right. Hi, Susan. Right now, we don't have any condition that is an absolute contraindication. What that means is that there is no stated condition that disqualifies you from the vaccine.
Okay.
That said, if you've had allergic reactions before to any vaccine or to injectable medicine, I want you to check in with your doctor first. If you have any history of allergies to vaccines, just to be sure that you're not going to be allergic to this one. If you don't have a history of allergy, right now, there is no recommendation for you to not take the vaccine if you're eligible. But if you have specific concerns, just because I'm not able to tell you based on I don't have all the details of your personal history, it will be best to have a conversation with your provider. If you don't have a provider, you can also call 311 so they can go through the history with you and tell you what's best.
All right. So since I'm also living in a senior building, so is it like to prioritize because I'm living in the senior building?
Yes, if you're a senior and you live in a senior building, then you're currently eligible for the vaccine. And so if appointments are available, you should go ahead and book your appointment for the vaccine.
Okay, thank you.
Thank you very much, Susan, for your question. I'm just going to make a few adjustments here. I'm going to lower your hand. And next we have Jose Medellin. I'm going to allow you to talk. You should be able to unmute yourself and ask your question now. Jose, if you can unmute yourself.
Can you hear me now?
Yes, go ahead.
Great, wonderful. Thank you, Jonathan. I'm going to make a couple of clarifications for what I heard from the doctor and the commissioner. I am blind, commissioner, actually doctor. A friend was helping me last week to try to get an appointment. The phone number that you provide does not take appointments. It directs you to the website. That's number one. Number two, there are no appointments in any of the mass vaccination centers. The Javits, for instance, is close to me. I live in Chelsea. There are no vaccines or appointments for vaccination in the city, period. They told me 14 weeks. That's how long it's going to take. So those are two clarifications that I wanted to make. There's number three, there's tons of conflicting information out there. The reason why I tried to make an appointment is because I heard that underlying conditions, people with underlying conditions could make an appointment. That's not, you just mentioned, it is not true. Is that correct?
Yeah, so like Commissioner Calise was saying, some states have opened up to people with underlying condition. At this time in New York State, that is not the case. And which is why I provided information on where you can see the comprehensive list of who's eligible at this time. So I think that sometimes, information get crossed, but for New York State, the list that's currently eligible is on the website. And right now it's not yet extended to people with underlying conditions just yet.
And that is my point. There should be a way, if there's a way that you could help. I don't know if you have this to do in the government, but why is there so much conflicting information? I mean, it needs to be clear.
Right.
Here, I shouldn't even go and try to make an appointment right now. I'm not older than 65. I have underlying conditions. So it has to be clear for people. Right. Otherwise, people are running like headless chicken all over the place, trying to get vaccinations when number one, there's no vaccination appointments. Number two, people don't qualify. So if you could help us with that would be wonderful. Yes.
Jose, this is Commissioner Calise.
How are you?
Thank you for talking. We feel your pain, and I faced a lot of pushback on, do we come out right now and tell people what we know, or do we just keep quiet? And I felt that we needed to be as transparent as we possibly could to our community, because there are too many conflicting things. This is the reason why, Jose, we put this together. This is why we had over 200 people on the call, because people are concerned, and we're messaging all of this via social media. We're putting it through our listservs. We're teaming up with the Department of Health and Mental Hygiene because we know they're the lead on this. And that's why Dr. Ige is here today. So we do feel your pain. We're concerned just as much as you are. And any way that we get information out, if there's a better way for us to do it, please let us know. But we're doing it through our listservs, or social media, all of that now. So thank you.
Thank you, Commissioner.
That's great. And thank you for that. And I just wanted to follow up with you, Commissioner. So you mentioned that we should be, as individuals, advocating with elected officials. Happy to do that. You know what would be helpful? If there would be templates and scripts to make phone calls as well. You all have a list of people, emails, and like, for instance, I received this email. So if the team in your office could write a script so that we can just and give the phone calls, the phone numbers for people to call, that would be very helpful. If you have a template as well on what to put on an email, that would be very helpful as well. And the email addresses for the elected officials. We met, you don't remember me, but we worked together. I work for Goodwill Industries. I'm the Director of Communications, so we worked together before. So that would be very helpful if you could help us with that.
Yeah,
happy to advocate.
Jose, pleasure to meet you again. I would love to tell you that we would be able to give templates, but that's not something that our office does. Some advocacy groups that are on the call, independent living centers, or Goodwill Industry themselves might be able to advocate that way. What we can do is provide you with the website who represents you, and we could send that information out, and we can put that in the chat. And that's what we can do. We're not someone that puts templates together. It's just not the part of the role of government. Our information is our role here is to get the information out to you and let you know where and how you can do those things. So I just want to be clear, Jose.
Okay. Thank
Jose,
you. This is it. That's all. Thanks.
Thank you very much, Jose. And I will say that there is so much information out there, and so much of it is excitable and wrong, and it's really frustrating. And I can only imagine feeling one way only to find out at point blank range that something you thought you qualified for, could get an appointment for, is not available. Here in our office, we're doing everything we can to send out messaging that's honest and also specifically pertains to the disability community. So we invite you to join our listserv, to follow us on social media, and to join our monthly calls that we're now having as we try and navigate this together, and also help us get the word out by amplifying our messaging as well. But thank you so much for bringing up that important point.
And Jonathan, Michael Schnall from Staten Island put information in the chat of who represents me. So it's in there in the chat, and you can get there. Thank you. Thank you, Michael.
I'm just going to copy and paste that and send it to everybody. Michael, thank you so much for putting that in the chat. I'm just sending it to all attendees now. Okay, we are going to we're going to switch back now to, hold on one second. So we're just going to switch back now to the Q&A to try and keep it balanced between questions. So, but we will, please keep your hands up. We will, continue to move through as many questions as we can. So Anne Macaron asks, why does the website, quote, am I eligible, only show the state pods, not all distribution sites statewide?
The website? So the website If you go to the Vaccine Finder website, it's going to show you a list of all sites. And if you don't mind, I can show you what that looks like. Because I
Sure.
think it might be helpful.
Do you want to share your screen, Doctor?
Yes.
Okay, let me just configure that. Okay, you should be able to share now.
So this is what the website looks like, and it shows you if you're currently eligible, phase 1, phase 1B, etc. So this is where you can find the entire list of who's eligible. And
My apologies for the intrusion, but if it's okay with you, do you mind if I just give a brief audio description with a little bit
Yes.
more? So the current page that Dr. Ige has up for our friends on the phone and individuals who are blind or low vision is COVID-19 vaccine eligibility. On this page, it's primarily text, but there's a list that's broken down very clearly that states currently eligible for the vaccine. It states the phase as well as the individual based on either profession or age or specific person. If you keep scrolling down, it goes into the dates of when each one was active, so you understand when the most relevant information is or when this took place. And then eventually at the very bottom, it states the next eligible groups, both in the date as well as what is likely starting or the projections for eligibility groups and things like that.
right.
Please.
And then the next thing I'll show you is on this page, it says, if you're eligible, find a vaccination site near you. And if you click on that, this is what you're going to see, this vaccine finder page. And let's say you live in, you put in your zip code and you type that. What is going to happen? You're going to get a list of sites around you. So if you're able to see, there's a site that says NYC Health and Hospitals. So you can tell that this is a health and hospital site. Then there is another one that says Rite Aid. So you will know that this is Rite Aid. This is not a city-run site. Then you will say StatCare, which is a private provider. And then you will see NYC Health Department, Elmhurst Clinic. This is a city-run site by the Department of Health. And here you will see NYC Vaccination Hub. These are the mass vaccination site I was trying to tell you about. And one of them is Aviation High School. So let's say I click on that and say schedule an appointment. What you're going to see is there are currently no first dose COVID-19 vaccination appointments available. So you will not waste time trying to fill out a form or get an appointment because it tells you immediately there are no appointments available. But then it gives you this option to schedule your COVID-19 vaccination appointment. And if you're eligible, New Yorkers can subscribe for 2 weeks of email notification when new appointments are added. So there you can put in your email and subscribe. That way you will be notified if new appointments become available at a city-run site. Now, this is only available for city-run sites. If you go to, let's say, a Rite Aid store and you click on schedule an appointment, it doesn't say whether an appointment is available or not. It tells you the number of users in line ahead of you and the expected arrival time on the website. So you have to go through this process to get on the website and fill out a form before you are then told there are no appointments available, or you just find that you're not able to submit. And this is the limitation of this site because there are different kinds of providers and they use different processes. So that is something I wanted to flag for you. If, on the other hand, you decide to check out a site that is health and hospitals and you click on schedule appointments, you will see a different interface. and it will ask you a bunch of questions, how you're eligible, and when you check that, you will see a bunch of other questions that you need to fill out. And then it gives you more questions on if you've had allergic reactions, if you're pregnant or you're breastfeeding. And it asks if you live in the city and what do you do, and if you live in an ambulatory care setting, or if you work wherever you work. And then it asks for your name, your first name and last name, and you check on this, and when you click here to schedule your appointment, if an appointment is available, it will let you through. If there is no appointment available, it will not let you through. So this is the complication that we have right now, because all of these sites are run differently and the process is a little different. So I just wanted to flag that for you. So if you run into any of these problems, you know what is happening.
Thank you very much, Doctor. And to be clear, the website that's currently being shared is vaccinefinder.nyc, and then I lost it. So what's the last bit?
Oh, I'm sorry.
That's okay.
It's vaccinefinder.nyc.gov/locations.
Perfect. Thank you very much for that, Dr. Ige. Okay, so the next question we have is what accommodations are going to be made for people with sensory issues or other conditions who cannot wear a mask to their vaccine appointment? So this might be something that we need to talk about. This was an issue that has come up. In early COVID, this issue was brought to our attention. Many people with disabilities are unable to wear a face covering due to respiratory issues. And as a result, we had many conversations with different business owners, with human rights around, services that can still be provided either outside of a building or other ways that business owners or people with disabilities who are unable to wear these masks won't be discriminated against. But for this particular issue, I think it's something we're going to need to circle back on, but it's incredibly important for us to recognize, identify, and determine a solution. So thank you for bringing this up.
Right. And I'll only add that, it is our hope that individuals will be able to get their vaccine from their preferred provider or from their usual primary care provider in the future, which will help limit some of these challenges. So yes, we'll need to circle back to that when we have more doses available.
Wonderful, thank you. Next, for proof of eligibility, do people who live in qualifying congregate care facilities have to have a letter from the executive director of the residential facility?
A letter will be useful unless there's another way for you to say that. But right now, in congregate settings, the vaccines are actually taken to them. So that's not been a challenge. So for those who are in congregate settings, the vaccination is taken to them rather than them have come out and take the vaccine.
So to be clear, an individual doesn't need to, an individual would just contact the facility or speak with facility staff that they are in that qualifies.
Right.
Okay, perfect. Thank you. This next question is from Arnold Lau. How is it like for a person to volunteer for the vaccine since it's offering to CUNY students? I'm not sure I understand the nature of the question. Dr. Ige, do you?
I am not sure. Is this about wanting to be a volunteer?
Arnold, would I be able to unmute you and you can clarify? I'm going to allow you to talk and you can just ask your question now. Okay. Hold on one second. Okay, Arnold, I'm actually going to need to promote you to a panelist, so you're going to have the option to turn on your video as well. So Arnold, you should be able to unmute yourself now and ask your question.
Yes. Good afternoon, John. How are you doing today? Yes, my question is that, so like my friend in my neighborhood lives near me, and then I found on a vaccine about, so I would need to know like how's the like working conditions, like doesn't involve like injections, because I have no medical experience. So like I just applied yesterday to volunteer, but I'm still waiting the email. So like I'm wondering like when you actually work in the department, because I'm not sure where I'm going to be at a college or any public school site. So I just want to clarify like how's the situation, how many people come in and stuff with the social distancing, what's going on. Like because I'm a volunteer.
So in terms of what are the volunteer opportunities for getting involved with Department of Health and Mental Hygiene?
Yeah.
So that like what would that entail?
And if it's getting like overwhelmed, like crowded situation at place, like we'll be there in a 6 feet situation. Like I don't want like crowded stuff.
Right. Okay.
Because you know just saying I'm very
Right. At this time, the Department of Health is not taking volunteers directly. There are some community-based organizations that are taking volunteers who are helping older adults navigate, help them set up their appointments, help accompanying them to their vaccination site. If you do want to volunteer with a community-based organization to do that, we encourage folks to remember all the preventive measures, stay 6 feet apart, wear your face mask. At the vaccination site, we're doing our best to ensure that there's social distancing, which is why appointments are required in the first place, so that we don't have too many people in a location and being exposed, potential exposure. So if you want to volunteer, that will be my recommendation. If there are community-based organizations around you that are, helping, particularly older adults, set up their appointments.
Yeah, in your question, you mentioned CUNY. I would recommend wherever you saw volunteer opportunities to respond directly to CUNY and see what is available, as they might have things that we're not quite aware of.
Right.
Yeah, sounds good.
Right.
Sounds good. Commissioner, all that. I don't pronounce your name. So yeah, I'm just looking for other organizations that's outside of CUNY. So I'm just looking.
Of course. Well, any opportunities that come up, we will be sure to share them. But thank you very much for your question. We're gonna keep it rolling. So thank you very much, Arnold. Next, we have a question. Is the appointment phone line able to handle calls for those who speak languages other than English?
Yes, the answer is yes. It will prompt you for other languages, and yes, there's several languages available. On paper it says 180 languages, but I am pretty confident that you should be able to get the language of your choice from that list.
I love the simplicity of that answer. It's just yes, absolutely. Thank you very much for that question, and thank you for that answer. The next question is, if you got the first dose, is the second dose guaranteed at this time?
It is supposed to be guaranteed. Providers are supposed to keep a list of first dose and make sure that they have second doses. We're not sure that all providers right now are adhering to that. So I have heard of people saying that they're not able to get appointment for their second doses, which is something that we are still looking into. But the expectation is you'll be called or sent a reminder for your second dose, and you should be able to get your second dose. But if it happens that you're not able to get your second dose or schedule your appointment when expected, if you got Moderna, you have a window of 28 to 42 days to schedule your appointments. So we don't want you to get worried if you're not able to schedule your appointment immediately. If you're able to schedule within a 6-week window, you will be fine. But if not, you still don't need to start all over again. So we just want to reassure folks that even if there is a slight delay, do not panic. The expectation is that you will be able to get your second dose.
Thank you. It's incredibly helpful to know. Next question is from Anna Packman. Are city-run sites responsible for scheduling the second dose at the first appointment? My aunt got a #1 first dose of Moderna earlier this week, but they told her to go online, and appointments for 28 days later were not available. Earliest was for 38 after the first dose.
Right. So what we're doing different now is having staff, Department of Health staff, help with scheduling the second dose on site. That tends to take some time, but that's happening now. So if you're doing your first dose that day and you need help scheduling your second dose, you're able to do that on site. But not all sites are doing that. So I can imagine that some folks will still need to go back online and schedule their second dose. So I think that's where we are now.
Thank you very much. Next question is, I am a resident in New York City. When do you think we could get the vaccine appointment? Now, this is a very nuanced question. It depends on your age. It depends
Right.
on if you're living in a residential, in a care facility, what's your occupation. For the latest information, I encourage you to visit, I put it in the chat earlier, but I'm just gonna pull it up again. The eligibility site,
Okay.
which is, I'm just having, unless you can call it up from memory, Doctor, for some reason, I'm just having trouble.
I can paste it again.
Okay, that would be perfect. But that's where you're going to get the latest information on the Department of Health's website for New York City, talking who is available. It's the same page that Dr. Ige shared before. Yes, thank you very much, Shahara. That website, which includes not only who is currently available, but the expectation for who might be coming next and when that might be. Although this is all in speculation, there could be things that happen that might push the eligibility opening in one direction or another. So we encourage folks to just continue to look at reliable sources of information from CDC directly, from State Health, from Department of Health directly, specifically City Department of Health, considering cities are doing different things, states are doing different things. So stay tuned, basically. The next question is, the New York City Vaccine Pod website requires an email address to register before searching for available appointments. Is it required to create an email address for each individual? What do you suggest when it is necessary to make an appointment for more than one eligible person, like 2 adults in one family?
Right. You're not able right now to make an appointment you're not able to make different appointments with the same email. So once you have one email in the system, it's not going to let you use that email again. So if there are multiple people in the family, you will have to create different emails for each person. And that's to stop folks from booking, one person from booking several appointments and taking up all the opportunities. So that's a bit of a headache for those who have multiple family members. But unfortunately, I think that's right now it's one email to one person.
Next question is from Belinda Simmons. If a person is asymptomatic and does not know that they have COVID and they get the vaccine, will this affect the vaccine?
No. So previous COVID infection doesn't affect the vaccine. If you're asymptomatic, it doesn't affect the vaccine. So the answer is no.
Thank you. Okay. Next we have, we've answered this before. You mentioned that a mask must be worn or an individual might be turned away. What if someone is not able to wear a mask? We don't have an answer for that, but we understand the complications that this can cause for a person that is unable to wear it. So this is something that we're going to have to converse with for the Vaccine Equity Task Force that we're on, as well as the just other members who are responsible for rollout. So we will have an answer, but for now, we're just going to need to look into it. But thank you very much for bringing this up. And then last Q&A question before we turn back over to the calls. I would like to know if it's possible, when will the vaccine be available for children? Which I think we've touched on this a little bit before, but Dr. Ige, if you could remind us the ages.
Right. So for now, because the vaccine trials did not include children, the vaccines are not authorized to be used in children because we don't know if it will be effective in children yet. So for Pfizer, it's only available for 16 years and above. For Moderna, it's only available for individuals 18 years and above because those were the ages involved in the trial. Right now, both pharmaceutical companies are conducting trials in children. So we will know soon if it will be okay to use in children. But for now, it's 16 and above for Pfizer, 18 and above for Moderna.
Thank you very much. We are going to now shift our attention back to the participants who are raising their hands. Thank you everyone for your patience. We're moving through the questions as best we can. And we appreciate everyone that's still on the call and hope that, and appreciate everyone asking this information and having this discussion with us. The next question is from Marissa Lalagayas. I'm going to allow you to unmute yourself and you should be able to ask your question.
Hi, thank you so much, Jonathan, and thank you, Doctor, and thank you, Commissioner Calise. I am asking this question because
I'm sorry, Marissa, I'm sorry to interrupt you. Are you speaking with headphones or it sounds like there's just some scratching taking place on the microphone. It's a little difficult to hear you.
Is it okay now?
Yes, that's better. If you could just speak as close as you can to the microphone and please just start over. My apologies.
Yeah, thank you, Doctor. Thank you, Commissioner Calise, and thank you, Jonathan. Prior to COVID, I had a caregiver who was not employed by the state and she did not live with me, but she did take me to essential doctor's appointments, make my meals, and other necessities. I know that because I am visually impaired and have cerebral palsy, I am not yet eligible for the vaccine, but I am asking on behalf of my mother because I spoke with the Department of Mental Health and Hygiene, and they said that since March, which is when my caregiver was let go, my mother could qualify for the vaccine. Is this true?
I'll ask, is your mom 65 years or old?
No, but she has arthritis. But she's taking care of me. She's cooking all my meals. She's buying my groceries. She's making sure that I stay 6 feet apart from people because of my visual impairment. I can't see whether people are wearing a mask. She's been taking me to doctor's appointments.
Okay, so your mom will qualify as a home health aide. Do you have any documentation that can support that?
No, but I do have receipts from doctors and we could, does she need a doctor's note? What does she need?
I think she'll only need something, you know, in this instance, if you're her employer. I know that the state requires home health aides.
I'm not her employer, but when I spoke to someone at the Department of Health and Mental Hygiene, excuse me, they said that because she's fulfilling the requirements of my previous employer that she would qualify.
Yes, and that's what I mean. She will be eligible because she is functioning as a home health aide. She's helping you in that capacity. And right now, home health aides are eligible. What I'm trying to establish is, will she have some documentation to support that?
She doesn't have any documentation to support that. What documentation would she need?
I think if you will write a letter as her employer and have something to show that.
But I don't employ her. Do you understand?
Right. It's a bit challenging because there is need for some documentation to support that. But I expect that if you go with her and be able to say that, you know, she's your mom and she does this for you, I believe that there should be some consideration provided. I'm not going to be able to say conclusively that that will be the case, but she's eligible based on her, you know, what she's doing now as a home health care aide. The only limitation is what kind of proof can there be, and if you can go with her as proof, then I think that will.
Okay, thank you very much.
Marissa, this is Jonathan Novick. I just want to add that if you've registered, I would encourage you to, I'd encourage you to reach out to our office. This sounds like an issue that is going to pop up, and we've been hearing has been popping up for other individuals who do qualify, but work directly within family care. So perhaps we can be in contact. You can send me an email at jnovick@cityhall.nyc.gov. It's the same email address that was on the flyer to request accommodations. Do you have that on file?
Yes, I do. And I remember, Jonathan, we spoke on the phone on.
We did. I thought we did. Yes. So that's something we're still looking into. So I do have your contact information, and I will be reaching out to you. Hopefully we can come up with some kind of solution. But Dr. Ige, thank you very much for that initial insight. I just got a message from a good friend of our office, Jason Eckert, who's from the New York State Commission of the Blind. And he said the commission might be able to help assist with this. Can you ask her to call the New York State Commission for the Blind office and assist her? Jason, what's the phone number, Jason? Would you mind plugging that in? Or better yet, I'm just going to unmute you, Jason, if that's okay. Okay, he says 212-825-5718. So that's 212-825-5718. And Jason, if you could keep us in the loop with what you're able to come up with, that would be extremely helpful. We'd love to help amplify the message. Thank you. Okay. And I see some folks are putting in the chat that they're in a similar situation. Please feel free to reach out to me at jnovick@cityhall.nyc.gov. I just put it back in the chat. So feel free to send me an email with more information. And once we do have a solution to this issue, we'll be sure to follow up, amplify it on our networks, and follow up with individuals. So thank you all very much. Okay, give me 1 second. Just going to make a few adjustments here. And we are going to now hear from Liliet Lopez. You should now be able to unmute yourself. Go ahead.
For those who do not have a subscription with paratransit, can they still get accessoride for their vaccine, to go to their vaccine location? Because my understanding is that you have to be approved for paratransit in order to get accessoride. Also, how can you find out if a place is accessible?
So I can actually answer a few of these. So yes, Accessoride is a subscription-based service, or at the very least, you have to qualify for it and apply for it. If you do qualify and you're interested in applying, this is something our office can help you with. But in the meantime, are you someone that would require an accessible vehicle to get from point A to point B?
Not me, but somebody else, but that person does not have Accessoride. But being that in the website it says Accessoride will be provided, but if the person does not have it, how can it be provided?
So while the qualifications for the transportation are currently for seniors, this is something that we are looking at. And Dr. Ige, correct me if I'm wrong, but it's for individuals 65 or older for this transportation at the moment.
Okay. Yes.
There are other opportunities for physical accessibility. So for example, you could use accessible dispatch. This would cost more than $275, but it's accessible yellow and green taxi cabs. You can call 311. You can text, you can download the accessible dispatch app as well. You could also look into ambulance services, considering I believe this would be a medical appointment. So there are some resources actually on our website that I encourage you to take a look at. I'm just going to pull up the link for that now.
I did. That's what I was asking the question. And also accessibility. How can a person find out if they, if a location is accessible?
Sure.
I didn't see anything regarding listing accessible locations.
Right. So on the vaccine finder, the map that Dr. Ige pulled up before, there are some indicators of physical accessibility, and these are reflected primarily on the health and hospital run sites, as well as the schools. We've worked closely with the Department of Education previously in classifying the accessibility levels of schools, and those that have been selected are accessible as well. But that does not mean these are the only ones. It's just a question of identifying. I encourage you at the moment to use the vaccine finder and look for those icons that those are accessible. The hubs, I believe as well, Dr. Ige, because these are larger facilities such as Citi Field and others, those are accessible, and you can count on the accessibility for those as well. But in addition, you should always call ahead if you're uncertain for those individual appointments. But this is something that we are working on. As Commissioner Calise mentioned earlier, we have been sharing accessibility information and guidance for those community groups that are being pop-up locations. And we're going to work on not only ensuring the physical accessibility for these sites, but also that it's reflected in the website and the communications materials that surround it. So, you know, you shouldn't have to hunt for this information. So we are working on it, but currently right now, this is the best information I can provide. So thank you very much for your question. We're going to keep moving. Next, we have a question from Enrique Colon. Enrique, you should be able to unmute yourself and ask your question. Enrique, if you can unmute yourself. If you're having an issue, you can put that into the chat. Enrique, in case you...
Yes, hi.
Oh, hi. Okay, go ahead.
Yeah, I was just taking my medication.
No problem.
You was talking. That's why it was taking me a long time.
No problem.
All right. This goes along with people with the disabilities. I am a 60-year-old man with cerebral palsy, agitoid voluntary movement, and I've been at home since March 12. I have anxieties of going out, so I've been home since March 12. I'm a self-advocacy advocate. I joined a self-advocacy group in the Bronx. We do Zoom every week on Thursdays at 2:30. Now, I know I've been hearing that people like me are not, the vaccine is not due out to be taken. And there's a shortage of vaccines. That's mandatory, and which I heard it on the news. I'm always constantly, I don't read the newspaper, but I'm always current with what was, current events with the news. So And is there a way, although I do have a person with my case manager uh, put me in this program where the doctor comes to the house and sees me. I got the flu shot for that. I just got a call yesterday that the doctor will come on some Sunday to check up on me. And I asked them yesterday if they got the COVID-19 um, 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 vaccine. They told me no, they don't have it because due to the shortage of respiratory. So I mean, you know, that's pretty much what I wanted to say, and it's like, you know, I've been here since March, and I have anxiety of going out there. If I do go out there, I have to put a mask, and if I put a mask, I'll start drooling, and that's gonna be all wet, smelly. If, you know, that's the reason why I'd rather stay home. You know.
Enrique, thank you very much for sharing your experience. I know it's been a very difficult year, and it continues to be, even though we're in 2021. And we're hoping, you know, with these vaccines that it feels like the sun is rising. It feels like we can see the end, and we really, really want to get there. But unfortunately for now, it's waiting. It's waiting on eligibility to expand. It's waiting on the supply to meet the demand. And we're hoping that we can all soon get administered, or, you know, begin to reopen again, so we can get back to our normal way of life. I'm really happy to hear you're part of a self-advocacy organization. We'd love to have you on our monthly call as well. I'll make sure that we re-include that in the email that we sent around at the end of this call. And as well as other ways that you can continue to engage with people, either online or in discussion. We've been keeping a pretty robust list. Our digital accessibility coordinator has been keeping a list of virtual activities and ways to stay active during COVID as we all stay at home, because it's been a difficult year. But I appreciate you sharing your experience today, and I hope this information is helpful. And thank you for sharing.
You're welcome. Thanks.
Thank you.
And I'll be saying to everyone, I know maybe I'm being negative, but just like I said to all the people, if 50% like you and I and all the commissioner and all are doing what they're supposed to be doing, if those 50% like you and I are doing what they're supposed to be doing, but then again, in the Latin countries, like Santo Domingo and Ecuador and places like that, they're having these wild parties.
Well, I think everybody is responding to things differently, but here we're doing everything we can in the 5 boroughs. Thank you, Enrique, so much. We're going to continue taking questions. We only have a few minutes left. So with that, I am going to call on Gemma. Gemma, I'm going to allow you to talk. And as a reminder, unfortunately, we're not going to get to all the questions today, but we will follow up. Please email us. Please respond to the notes as we send them. So with that being said, Gemma, the floor is yours.
Hi, how are you? My question is, if the vaccine is safe, and how would we know if it's safe?
Right. So I can respond to that and say, yes, the vaccine is safe. And when we say safe, we mean that this vaccine will not give you COVID-19 virus, which is a concern that people have, because it does not contain the virus. We also say it is safe because it has gone through all of the stages to assess its safety. The first phase in vaccine development is that it is tested in the lab to make sure that it is effective and it is safe. And when it is shown to be safe, it then goes on to the first phase of trial with a few hundred people. And then they're monitored to make sure there's nothing out of turn happening. Then when that stage is passed, then they go on to a few thousand people. And then the third phase is more 1,000 people. So for the Pfizer, the phase 3 trial involved 44,000 volunteers. And they took this vaccine, they checked and made sure that, you know, it was effective. It actually protected them from COVID, and no unusual side effects was reported during the time that they were under study. And for the Moderna vaccine, they had over 30,000 people volunteer for the phase 3, and they were also monitored for any concerns. As at now, no serious safety concern have been reported for either of those two vaccines. And as of today, we have over 500,000 New Yorkers that have received the vaccine, and over 60,000 people have received their second dose. There is a vaccine adverse events register where any safety concern is being reported. And to the best of my knowledge, no serious concern has been reported from either of these vaccines. I did share about the side effects that you know, may happen, which is mild and moderate soreness at the site of infection, at the site of the injection, some headache, tiredness, some fever, but these side effects last a couple of days and then they go away. Nothing more serious than that has been reported. Some people have allergic reactions, but these allergic reactions have been seen more in those who have had previous allergies, and all of those who have had allergic reactions have recovered after treatment. So this is why we are confident to say that the vaccine is safe and effective.
Okay.
Thank you. Thank you, Dr. Ige. Gemma, thank you for your question. Okay, we have time for just one more. Next in line is Jennifer Silverman. Jennifer, this is going to be the last question that we have, so please ask away, and after this we will conclude. You just need to unmute.
Hi. Yes. Hi. Thank you. So you mentioned coordinating with providers for vaccine distribution, and I wondered what efforts have or will be made to work specifically with disability providers like Premier Healthcare or community-based organizations that serve the disability community.
That's an excellent question. Dr. Ige, do you want to?
Yes, I will start by saying that there is a lot of planning that's going on. What is limiting the scale of vaccine availability is the limited number of doses. As more doses become available, more providers will be able to get the vaccine. And we're hopeful that when everyone becomes eligible, these vaccines will be available at your preferred providers' locations. As at now, that is not the case because the doses are limited, and because of the handling, it's only available in a few places for now. But the expectation is that more and more locations will have these vaccines as doses become available.
And to add to that, MOPD does have a list of community-based organizations that we regularly work with that we'll be asking to, and have been asking to help us get the word out, help us get information, but as well to be in certain instances, those facilities that can help us get the doses directly to the community. But this is all in flux, as Dr. Ige mentioned, based on the availability of the vaccine. But thank you very much. That's an excellent question.
Okay.
So it is 2 o'clock. This is going to conclude our vaccine town hall today, but I just have a few things I want to finish with. First, thank you all so much to the fact that we had hundreds of people present today to listen to our conversation, to ask questions. We really appreciate your time today, and would additionally appreciate if you could help us spread this awareness in an accurate fashion. We understand it's difficult with misinformation and different takes are being spread around. Please help us share the vaccine finder. Help us share the eligibility requirements directly on Health site. Subscribe to Health and Mental Hygiene social media account. Subscribe to ours as well. We'll be sending out a copy of this recording as well as a copy of the transcript, in addition to Dr. Ige's PowerPoint that she presented at the very beginning. All of this information is fantastic as well that you can share in your listserv, in your community, with your friends, with your family. Please help us get this accurate information out. But thank you all so much for joining us, and I hope everyone has a wonderful weekend. Dr. Ige or Commissioner Calise, anything else to add before we go?
Just want to say thank you, Dr. Ige. Very important for you to be here today. Thank you for your support, and I'm sure everyone has certainly benefited from what you said today. And Jonathan, thank you for everything that you put on getting through this today, and the rest of the MOPD staff. Stay safe, wash your hands, wear your mask, keep your social distancing, get tested. And as soon as the vaccine's available, we will let everyone know. Thank you.
Thank you, Commissioner.